MRT supportive housing in the work group, and funding has been up and running for 3 years now. And we continue to grow the program because we do believe, that housing is health care, and that you can't effectively address an individual's health care if they lack basic needs such as housing. And so we really do believe that in order to effectively improve the quality of life for an individual, improve quality health care for an individual, if you don't provide housing to that individual, you're never truly going to make them healthy. So the state of New York really is trying to do new and innovative things with the Medicaid program in terms of reinvesting Medicaid savings and investing those savings into supportive housing. So I just wanted to kind of run through some highlights of the program, give you a sense of what we think has worked over the past 3 years, give you a sense of, as we're rolling out, the program, what we're learning, what we're looking to change, and what changes and refinements that we expect to see in the coming year. So just to give you a brief overview. The MRT right now has invested $388 million. This is from 2012 all the way to 15-16 in Medicaid reinvested funds, and those funds fund MRT supportive housing, which essentially is targeted at high-cost Medicaid members throughout the state of New York. And we fund the construction of new capital units, and we also fund rental subsidies and service supports for our high-cost Medicaid members. I'm happy to report that it is the largest state-only Medicaid reinvestment in the country. So, while $388 million doesn't seem like a lot of money, I always stop to think that we are very lucky in New York when you look, at other states where they don't really have the same opportunities, they don't have the same challenges, and they also don't have the same opportunities that we have within the state of New York. As mentioned, our MRT supportive housing program, we serve a variety of populations because we do see so many populations throughout the state that need housing, whether they're in shelter, they're aging, they're in the nursing home looking to move into the community. But our one key indicator is that these individuals have to be what we're calling high-cost Medicaid members, because one of the key pieces of the MRT is essentially to analyze Medicaid spend, because we consistently see the Medicaid program, spending unnecessary dollars, whether it's nursing home, hospital, ER, for individuals, and we think it's a much smarter investment to take that money and fund it in supportive housing to make sure that individuals improve their health care, go to preventive services, don't cycle in and out, of the hospital and the emergency room. So we think there's a lot that can be done here. And I did mention that our investment targets 3, key pieces for supportive housing: capital construction, rental subsidies, and service and operating. And so some of the accomplishments that I think we have achieved over the past 3 years, we've created a new resource and revenue stream for supportive housing within the state of New York. And, I think, some revenue streams throughout the state and city have remained flat or decreased. And so this was really a new resource that the state brought to the table to invest into supportive housing. We also support a variety of populations throughout the state. So what we're trying to do, and what we hear from stakeholders throughout the state of New York, is there are many, many individuals who need housing. It's individuals in shelter. It's keeping seniors housed for as long as possible in their apartment. It's moving individuals who have developmental disabilities into less restrictive settings. It's housing individuals with HIV/AIDS, mental health, substance use. So we're really looking across the continuum to reach as many high-cost Medicaid members that exist, and figuring out how best to provide supportive housing to those members. Also, the other thing that we've done is we've created a platform for stakeholder engagement. So we do have an MRT supportive housing work group. Right now, I think we have 40-plus stakeholders at the table, and I think it's a really important and one of the key pieces of the MRT to constantly hear from stakeholders, from providers, from other state agencies to figure out what they're doing, what's working, what's not working, and how we can change state policy to address the issues that you all face. And the last piece, which I think is a key component, is the MRT. It's not just the Department of Health. We work with, I think we're up to 7 agencies now, HCR, OMH, OASIS, the AIDS Institute, OPWDD, OTDA. So we've really tried to improve communications throughout the state and bring all of our agencies to the table. We meet monthly, and what I think had happened in previous years is each agency kind of figured out a program in a way to provide housing to their specific populations, and there was a lot of, I think, whether it's duplication of efforts or how do we really try to streamline the process to make it easier to provide housing to a variety of populations throughout the state. So lessons learned, I think over the past 3 years, it's hard to predict, as you're rolling out programs, what's going to work and what's not going to work so well. And so the first piece, and Moira is going to talk a lot more about this, is education and outreach. And one of the things I think I assumed was, hey, we're going to put all this money on the street, we're going to, have all of these available units and just assume people know that they exist, they know what they are, they know who's eligible. And we did find over the past year that was a challenge, and Moira's going to kind of dive a little bit deeper on what we did to address that. The second piece is tracking and evaluation, and this is a real key piece with MRT. Because, we believe that supportive housing works, we believe that it saves money and it improves the quality of life for many individuals, but we really need to demonstrate that, and we need to show the data to our federal partners. And so one of the things that we've created and what we are doing is tracking each individual who receives housing through the MRT supportive housing program, and we're looking at both pre-post Medicaid spend, and we're also moving forward with a research agenda to engage researchers to assist us with evaluating the data, so we have a very strong argument to prove the success of our MRT program. The third piece is housing need, and what I always ask myself as we're trying to figure out how do we spend millions of dollars and how best to target it is what is the need in the state of New York? Where do individuals live? What do they look like? Are they in shelter? Are they in nursing homes? Are they developmentally disabled? And so this is another key piece that we're looking to move forward with, is just getting a real handle on what the supportive housing need is in the state of New York so we can better target our resources moving forward. And the last piece is state and city resources. But what we've heard time and time again is how to better coordinate resources and roll out resources. So that's certainly another thing that we're looking to do. So as I mentioned, some of the refinements that we're making moving forward is regional meetings, and I'm not going to talk too much about that. The second piece is creating a centralized referral and tracking tool. And I know, I haven't been in the housing business too long. I think I've been doing this job for 3 years, but one thing we always hear, and I think you guys know 10 times better than I do, is housing is complicated. And so the real question is how do we make it simple, and how do we try to figure out a way to simplify the process, to make it easier and quicker and more efficient for folks to get placed in housing. And so that's one key objective that we're really looking forward to working on in the coming, I call it a summer project, and people laugh at me. And then the next piece is the statewide housing assessment. I think, this is a really key tool that we need as policymakers to figure out who needs housing and how many people, because time and time again when we have a resource, and I'll just give you one example, we work with HCR and we provide capital funding to HCR, and they ask, well, where should we put the housing? And so, you know, we definitely know that need exists everywhere, but we're really looking to refine what we know about need so we can better target resources moving forward. And then once again, improve the timing of state and city resources. You know, MRT is a very small component of, you know, the pie of resources that exist for supportive housing. And I think the state can do a better job. We can certainly do a better job on coordination of resources to figure out how to best use our dollars moving forward.